Well, good afternoon and welcome to our webinar, The Data is In, but How Does It Come Out? Beginning Analysis for Long-Term Care. My name is Tammy Bauman with Great Plains Quality Innovation Network, and I am one of the Quality Improvement Advisors here in Nebraska. Great Plains Quality Innovation Network is the QuinnQIO for Kansas, Nebraska, North Dakota, and South Dakota. Our aim is to achieve better health care, improved health, safer care, and lower health care costs for Medicare beneficiaries. I would like to welcome and thank all of you for participating today. We are fortunate to have representation from our 4-state region. Today's webinar will be recorded and posted to our website, greatplainsqin.org. Please note it will take approximately a week to access the recording. There will be an opportunity for questions after today's presentation by using *5, and Nikki Divis will be monitoring that, or you can post any questions via the chat function on the bottom right side of the screen. Lori Hintz will be monitoring the chat feature throughout today's WebEx session. Our Great Plains QuinnQIO nursing home team currently partners with and unites nursing homes in a collaborative structure to share tools, knowledge, and experiences for improving resident safety, clinical processes, and reducing preventable harm. Many of you on today's WebEx are already submitting HAI data, either C. diff, UTI, maybe gown, glove, or hand hygiene use into the CDC's National Healthcare Safety Network. Each of our states is currently working with long-term care facilities to create a national and state Clostridium difficile baseline and work to improve our CDI rates in each state. You can always be kept up to date by joining our Learning and Action Network on Great Plains Quinn website. Our website is full of tools and resources, and the LAN is a wonderful opportunity to stay up to date and connected. Great Plains QuinnQIO now has social media presence, so you may like and follow us on Facebook at Great Plains Quality Innovation Network or on Twitter at Great Plains QIN. Now I would like to introduce our speaker, Peg Gilbert. Peg is the owner of Quality IC LLC. Her focus is to improve infection prevention practices in healthcare facilities using proven quality improvement strategies. Peg has a master's degree in nursing, is certified in infection control, and was in the first group named as an ABIC fellow. Currently, Peg is managing a grant from the CDC awardee to the Nebraska Department of Health and Human Services on improving injection safety practices. Peg has spent several years assisting facilities with accurate reporting to the National Healthcare Safety Network database. I have learned a lot from Peg, so we are very lucky to have her. We welcome Peg for taking the time to present and for sharing her knowledge and expertise with us. So I'm going to turn the presentation over to you, Peg.
All right. Thank you, Tammy, and thank you to Great Plains Quality Innovation Network for asking me to speak today. I had the distinct pleasure of helping several of you enroll in an HSN and get started on this journey. And so it's really fun for me to be able to help you take the next step, and that's really in reporting and analysis. So here we go. The objectives of today's program is to help you understand how analysis can help you now that you've gotten down how to put in data, and also look at how you can interpret some of that data to improve your practice, because that's what this is all about, is how we can make our healthcare better for the residents that we serve. So first of all, it's kind of like, garbage in, garbage out. I wanted to just review how you do put your data into NHSN, so that we want to make sure that it's right on the front end. Throughout the years that I've helped people enroll in NHSN, inevitably someone will come along even a year or two later after they've been doing it and saying, I think I've been doing something wrong. And so I thought it would be good to just review the way that we do put the data in case that a couple of you the first time around realized that maybe things weren't quite the way that they should be. So remember, when you, we'll talk about CDI, because that was the first reason why a lot of you entered data, but we are going to talk about catheter-associated urinary tract infections a little bit today too. Remember that we introduced the event form, and that's an event in NHSN is basically what we call a positive test for CDI, because we're doing the type of aggregation that is lab ID. It isn't necessarily for sure an infection. But the electronic version, is there, and it's always good to do one of these each time that you do have a positive test. So just to review, when you enter an event, there's a couple of things that are really important on this particular slide that I wanted to review. You know that anywhere that there's a red asterisk, it's information that you have to put in. And then just a couple of things on short stay and long stay, that you do those correctly because those are risk adjustment variables. But the thing that on validation that does get some difficulty in people understanding is our correctly entering date of first admission. And so if a resident has a stay that is interrupted more than 30 days, you have to reset their date of first admission, because we know some of our residents are in there for months, years, long periods of time. So there may be a time where they are hospitalized for a long period or out of your facility for more than 30 days. So that's important that that date get reset. And then the other place is on the other side, where most recent data of the resident entering the facility. If the resident has not left the facility for more than 2 calendar days, that date and your 30-day date should be exactly the same. Why that's important is because these dates that you enter here are the ones that determine whether when you enter an event, it will affect whether they're determined to be community onset or long-term care facility onset. So the next question that I see some issues on sometimes are, how do I know if they're being treated for C. diff or not? Well, your transfer sheet is your best source of information for that. You want to have a question on your nursing admission sheet if you don't have one already, but also look at some medications that you would question if they are being treated. And some of the most common medications for C. diff are vancomycin, flagyl or metronidazole, or the newest one, fidaxomicin. So that's some big red flags for you to know whether they're being treated for C. diff. And also if they've been transferred from acute care facility in the past 4 weeks. Remember what that definition is, an acute care facility in the last 4 weeks. So it's not if they were in a different nursing home and then moved to your nursing home. It has to be a hospital, an IRF, or a long-term acute care hospital in order to say yes to that question. Okay, let's review UTI events a little bit and a couple of things that have been hang-ups on that at times of validation. The event details are important to make sure that they're accurate, and I can tell you that acute care hospitals, long-term care hospitals' definition of fever continues to be an area that is entered incorrectly. It's a small thing, but on fever, it's a single temperature, and here it says we normally do temperatures in Fahrenheit. It is greater than 100 or greater than 99. What we see is it's not greater than or equal. So the resident has to have a temperature of 100.1 or 99.1 in order to have this symptom, not just 100. If I'm clear on that. And then the colony forming unit count is important, because in long-term care, you only, if it is a straight cast specimen, it's 10 to the second colony forming unit, whereas if it's a clean catch voided specimen, it has to be a 10 to the fifth colony forming unit amount in that culture in order to be considered positive. There are 3 definitions for UTIs on here, and it's easy to mark the wrong one. We think of all of them as being symptomatic UTIs, but what happens is then you check that first box. Well, it's incorrect if that resident had a catheter in place. because it should then be the second one, a catheter-associated UTI. So those are just a couple of things that have been seen from validation that tend to be things that invalidate an entry. Okay, entering denominator data. And when we talk about events, that's all your numerator data. Your denominator data is just as important because a lot of the analysis that we do on these particular programs and report on to other people are rates that we have entered. And you get a rate by numerator over denominator. So for denominator data for C. diff reporting, that's your resident admissions, your resident days, and number of admissions on C. diff treatment. And so this is the area, or this what the screen looks like for your denominator data entry for C. diff, and then for catheter-associated UTIs. And remember, especially those of you that report acute care and long-term care, remember that with CAUTI data, it is facility-wide. So you put all your catheter days from all your areas together into one for long-term care reporting. Now, let's go to the next topic, and that's data quality. Data quality is you want your information to be as accurate as possible. So the first step in analysis is make sure that you have resolved all of your alerts. When you first sign on to NHSN, a screen comes up and it tells you any alerts that you have. Alerts are created in NHSN after you have not done something that in your reporting plan you have told the CDC, I am going to report this. And so after 30 days, if that's not been entered for that month, it creates an alert. And so that's where those come from. It all comes from your reporting plan. So they initially appear on the home page. However, there is also on your blue bar, which guides all of your entries. It's the very top link that there is. And I always think it's important that it's right there at the top because that's the first thing you got to do before you do any analysis. It's just an automatic check to help you remember incomplete data. You can click right on the alert, or else you can go to that alert link to resolve those issues. So if you click on the alert that is on your home screen, it'll bring up the alerts that you have in that category, and you can resolve them many times just right there from that screen. And one of the most common alerts that is missed is that reporting no events. That reporting no events is telling the system that I have 0 events for that month. And so 0 is a number, so that is in your numerator. And then be sure and press the Save button after you've done that. Otherwise, you can go directly to your summary data and resolve that alert the other way. And that's directly in the Report No Events line for your C. diff reporting. And that's why I've always encouraged you, whenever you enter your monthly data, to just always go ahead and click on those Report No Events buttons, because there's a business rule within the system that if then later you do enter an event, it will uncheck that box for you. Categorization of CDI lab ID events is also something that's important within analysis so that you know why things are grouped into different sections of the reports that you do enter. So I wanted to review that for just a minute. Under C. diff events, you have 2 different kinds. You have incident lab ID events. So that's your initial positive lab ID event. And you can't have another positive for 8 weeks. Whereas some people, as we know, C. diff can be a recurrent issue for a resident. And so a recurrent C. diff event is any time after 14 days. And why is that 14 days? Because that's the period of time where if there was another event, it would be a duplicate. And so it's from that 2-week period through the 8 weeks, which after 8 weeks would then start a new incident event. So initially you have an incident event, 2 weeks to 8 weeks, If there's a test, it's recurrent, and any time from the incident period for the first 14 days, it's a duplicate. I've always liked this particular visual because I think that helps you remember what is incident, what is recurrent, and then what is a duplicate. And that's just important to remember because you don't want to enter duplicate events into NHSN. And the system will not catch them if they will not always catch a duplicate event. So you might be having a higher number than what you really do because you've entered duplicates in there incorrectly. The other way that we categorize events in NHSN is whether they're community onset or long-term care facility onset. So if the date that the specimen is collected is less than or equal to 3 days, then it's going to be an event that is attributed that occurred sometime when that resident was outside of your facility, or it would be labeled then community onset, or on reports a lot of times you see it as CO. Now, if it is going to be attributed to your facility, then it's considered long-term care facility onset, or abbreviated as LO. And that's when the date the specimen is collected on day 4 or greater from the admission to the facility. There's an additional categorization for long-term care facility onset lab ID events into acute care transfer long-term care facility onset, which is a really long name. However, what it means is that the lab ID event specimen was collected less than 4 weeks from when they were transferred from that acute care facility. Remember, categorization is always based on the date specimens collected in relationship to the date of admission, and that's why I reviewed that part on one of the first slides about having that correct date of admission. Okay, and event data on your screen here is also important that we have that correct, that has the resident been transferred from acute care facility, and that's put down as correct. One more visual here of incident, recurrent, and duplicate, and then the acute care transfer, long-term care facility onset time period, so you can tell how they're categorized, so that you can help explain to others when you give them your reports. Okay, let's look at what statistics are available in the analysis section of the long-term care component. This is a listing on this page of what are the statistics available. And the initial one is the total CDI rate. And I've highlighted in the red box what that rate involves. And that is both your community onset and your long-term care onset events together. So that's all of your CDI risk available in your facility during that month, and then times 10,000, and that's just in order to get your rate up to a number where you aren't dealing with lots of zeros. The next statistic available is what your prevalence, or during the time of admission, prevalence always means point in time. And so when on admission, how many of your residents were on C. diff treatment? The next one is a statistic that says how many of them were facility onset, or that LO, long-term care onset. And this tends to be the statistic that is used in quality reporting. The next one is a percent that is community onset, and then also then there's a separate one for facility onset. I think these are in here mainly because people understand percent sometimes better than rates, or standardized infection ratios, which is another statistic that is used in other components of NHSN, but it is not used in long-term care component. The only concern that I have, and I just want you to be aware of with using percent, is your denominator needs to be above 25 to 30 before percents are a valid statistic to use. If they aren't above that number, they're really skewed because of the low denominator. The UTI statistics, let's look at what's there. There's the option for total UTI incidents. So remember, there were 3 different types of definitions for UTI, and those are combined all together. This one I think is important, the urinary catheter utilization ratio, and that's saying whether I'm using, how many catheter days am I using in comparison to all my total resident days. But I have to tell you that I'm seeing fewer and fewer catheters used in long-term care, and I just got to give you a big shout out for finding other ways other than using devices. And then another one I wanted to point out that I think is an important statistic that you can get from the analysis section is the UTI treatment ratio. That equals the new antibiotic starts for UTI over the total number of UTI events. And this is an important statistic to follow, especially as we know antibiotic stewardship is an important thing that we're following and trying to implement in our facilities today. Okay, let's get to the mechanics of the analysis section. We are there. As you know, it all begins with the blue bar. And on the blue bar, about 2/3 of the way down is a link that says analysis. And so that's where we want to begin. So in order, the first step in analysis is to do something that we call generating data sets. So you're going to click on your analysis link, and then you will see a link there that says generate data sets or reports. And you would then want to generate data sets. So what does generating data sets do? You know, when you put in your data on a monthly basis or how frequently that you do it, that all goes into big servers at the CDC. So what happens is when you generate data sets, it pulls just your facility's data to a separate isolated location and takes a snapshot of that. And that allows then as you do your report that it only has to look through this small one facility data rather than through all the 17,000 facilities that are on the servers at the CDC. So it organizes that data and allows you to much more quickly generate your report. So the important thing about that is this is a copy of your data on the CDC servers. It is not the live database. So why that's important is you can't delete it when you're using the analysis function. You can't alter it. You can't hurt it. So I just want to encourage you to take this step to do analysis because there's nothing you can do that's going to hurt your data in that section. Okay, so we want to generate new data sets. After we've cleared up, we've entered all of our data, we've cleared up all the alerts, then we're ready to go. So we click on analysis, generate data sets, and then we're going to get, click on the generate new. We're going to get a little timeline here that tells you how long it is taking for the CDC to get your information isolated into that separate little spot. And so the time it takes to do that has a lot to do with the quickness of your internet connection and then how busy the CDC servers are that day. But it shouldn't take longer for one facility than I would guess 10 minutes. Okay, so analysis. Generate data sets. You've gotten those generated, so now you're ready to do our next section of reports. So we click on the report section, and what's going to happen is you're going to get a listing with little folders of just a small of what you've got on the right-hand side of your slide, and the left-hand side as you're looking at it. And this is what they call a tree view of what the report section is. So if you click on one of these folders, then they will open up to more things, and if you click on that folder, it opens up to more things, and that's the way that it works. So the ones that we're going to use initially is the MDRO CDI module and the HAI module. So if I click on that MDRO CDI module little folder next to it, I get this whole tree view of all these other reports underneath of it. And so what we're talking about, because that's most of the data we've entered, has been C. diff. We would then, the next step, from the MDRO CDI module, clicking on that, and then next I would click on the C. diff lab ID event folder in order to get to reports that are very specific just about your C. diff data. Okay, if I wanted to work on my CAUTI data, I would click on the HAI module. The HAI module then would open up to a folder that says all UTI events. So that's where you find where the two ways that you want to go with the information that most of you is the type of information that you've put into the system at this point in time. Okay, for C. diff, your report options then are going to be, if I click on MDRO, C. diff, is simply going to be a line listing of all your CDI events or a rate table. For your HAI module, when you go to all UTI events, you're going to get a line listing and rate table, but since there's 3 different definitions that you put in, it's going to separate out those different types. So if you want all your UTI events, you would use the top line listing and rate table. If you just want those that when the person has a catheter, you would do the next line listing and rate table and on down. Okay, there's 2 options for both report types, and I thought it would be good to talk about why you would use one versus another. A line list is simply that. It's just a listing of all the individual record level review of the data you put in. So each event report that you put in there, that's going to be on a separate line. It's really helpful in pinpointing issues of your data quality and data validity. So it's helpful to do a line list after you put in all your data for the month, because then if you have forgotten something or entered something incorrectly, then you can usually spot it. A rate table is a calculation. So for quality improvement, rate tables are the things that you would want to do. It's going to be display of your facility's calculated rates based on your numerators and denominators that you've inputted, and it helps you pinpoint, as I said before, your quality improvement needs and allows you to track and trend from month to month, quarter to quarter, depending on how you're following your measures. Okay, so let's get to actually how you run a report. When you run a report in the analysis section, it's going to give you some options. So remember, we've gone from analysis, clicked on that, to report. We've selected the type of report that we want to run. And so when you click on, say, that line listing for all C. diff lab ID events, it's going to say run report, modify report, or export data set. I will tell you that myself, I choose modify probably 99% of the time. And why I choose modify report is usually I want to customize it in some way. And usually the way that I want to customize it is by time. Because I either just want 1 month of data or I want a quarter of data, that sort of thing. And that's the only way you can set a time frame is to modify your report. So I click on modify, and then it's going to bring up the modify analysis section. You can see how this is listed so far as top tabs at the beginning, that title, format, time period, filter, display, sort, display options. Those are the tabs that you will see for a line listing. And you will only see title, time period, filter, and display for rate tables. You will not see the display variables or the sort variables, only with a line listing. So it's going to ask you to tab through each one. So if you click on, so you have title format that comes up. The title is listed of the title of the event of the report that you had selected, and the format options are listed there. I usually leave when I do reports in HTML. It gives a nice looking report on my screen, and what I usually do with those reports is simply just copy and paste them onto a PowerPoint slide if I'm doing something for an inspection control committee or an advisory committee, that sort of thing. The only other option I can tell you that I ever use in the analysis section is the third one where it says XLS, and that gives you a report form that will go directly into Excel. If I'm manipulating events more than what I can do in the report section of NHSN, then I will export data and put it on an Excel spreadsheet. And just I've been comfortable with using Excel for many years. I can manipulate data in other ways there, sort, do more things with it. Okay, so title format, and then those are set there, and then I would click on the next tab called Time Period. Clicking on Time Period, this is where I can adjust it for that month or quarter, whatever I want it to be. So the date variable, you choose by the things I just said, and then you put in what month and the ending. However, you have to put that beginning and ending in a very special way. So with event year month, there is what I've chosen. Say I just want to know what my line list looks like for January of 2017. So I want to know what events I've put in there for just that month of January. So I have to put in 01, and the program will fill in that slash and then the year. And that table below where it says specify by, date variable, beginning and ending, that shows you if you choose, say, year half, you have to put it in by the year first. The system will fill in the H, and then you put in either 1 or 2. 1 would be January through June, 2 would be July through December, because NHSN uses a calendar year only when they do these calculations, these time periods for you. So this was very frustrating, and I had to copy off this little table for a while before I got the hang of it, because I would, as I sit in my office a lot of times, I would sit here and say, the system is fussing at me again, because if you don't put things in just exactly like this, it will not work. Filters are the next option for you to do. I don't use these very often, but on occasion I do if I want a very specific report. Like for this example, I wanted to only look at the C. diff events where the CDI had been treated, they were being treated for C. diff when they came into the facility. And that's the only way to get that. So depending on what report you put in, that is a drop-down box right here. It will only, you can do the drop-down box and you see what options that you have, and those are based on that event information that you put into the system initially. And then that greater than or equal, that then gives you options. Do you want it to be just this, or as I put there, greater than or equal? So as I showed you what that report that would then look like. Out of these residents that were admitted, only one of the 12 was being treated on C. diff previously. Okay, as I said before, line listings have more options to them. It allows you to display variables or sort variables. And all this does, when you think about a line list, it's really, it's a group of numbers that are arranged in rows and columns. So your display variables are your column headings at the top. The CDC, based on the type of report that you have chosen, has what they call a set amount or CDC displayed amount, and so they will pick these selected variables for you, and that's what I've got under the selected variables section. However, I can tell you sometimes I want those and sometimes I don't, especially if I'm sharing things with a committee. I don't want that patient ID in there. So all I have to do is highlight that and then select it over, and that will pull it over here. So then that will not be a heading in my report. Sometimes I don't want any of them. So if I just select all, then that's going to pull them all over here. However, more frequently, what I want is something that is in the display variables over here as options, and I do want a column on that. So I have to highlight this and then select for the arrow to go over here, and it'll move over to this section. And so that's how I can really customize reports. Now, you can see there's a lot of shorthand over on this side, and it gets worse as you scroll down because this is a great big list. So what you want to do is, if you don't understand what their abbreviation is or unsure, if you click on that part that says print list, it's going to bring up the whole listing without the shorthand part of it to help understand what it was. There was one thing on here I thought was really funny. About halfway down, there's AntiBxRx. What does that mean? Well, what that means is antibody therapy at time of transfer. Whoever would know that? Okay. Going on to sort variables. Remember when a line listing is just a bunch of columns put together, and so you've determined those column headings by the display variables section, but then sometimes you want your report arranged in a certain way. You know, I like to have the more general variables first and then get more specific as my report goes over. And so sometimes I want to move a location variable. I would click on that and go up. And so they're going to be arranged by how you put them in this box. So right now, event date would be the first column, location would be next, admit to event days would be another. And I just wanted to make a statement about admit to event days. I almost always select that variable when I'm doing reports. I think that's really critical in analysis of your reports because I like to look at, since CDIF is categorized based on the time of admission to when the event form was put in, I'm always looking for those where the event, where the specimen was collected, say on day 5, to see whether we're just missing it, we aren't quite being aware. The other one reason why I do admit to event for CAUTI is because I'm looking, okay, why did this person get a UTI? What can we fix about it? So if they're getting, if the UTI is being reported on day 3 after they've had a catheter 2 days, likely the issue to correct or to deal with is our technique of insertion. Whereas if the person has had the catheter for 3 weeks, it's usually a catheter maintenance issue that may have contributed to that UTI. So that's some way that you can use some of that information. Okay, display options is our last tab on the top. And what that does for the rate reports, it allows you to group them into a certain amount. I know in several hospitals that I've worked at, facilities that I've worked at, that the fiscal year especially is different from the calendar year that NHSN uses. And so dashboards and things are made a lot of times by fiscal year. So if you choose cumulative and then put in your time period of, say, July 1st, 2016 through June 30th, 2017, then you would get that type of fiscal year so far as your report data. Okay, so let's answer a few questions. What reports would I do in order to, that I was sitting here thinking about what would be useful? First of all, did I enter all my data? I get calls sometimes that people are frustrated. I know I put in 6 events, but I'm only seeing 5. Well, I think it's good to do a line listing after you're done, when you think you're all done with putting in your information for the month. And so, again, we would do analysis, make sure that you generate new data sets if you've done any change to your data, and MDRO, all C. diff lab ID events, and then line listing would be the way you would click along the system. Okay, that box I have up there under modify, remember there was run or modify, we would want to modify. And then for your report, I always encourage you to click on that show descriptive variables box. Otherwise, remember on those display variables where it has some real shorthand for different headings? If you click on the show descriptive variable names box, what that will do is pull in the whole sentence of what that particular variable is. It would have showed the one where transfer antibiotics on transfer would say that, or it would say infection count on it. So you would know just what you're talking about. And if you shared your report, then they would know what you were talking about too. Okay, so click on the show descriptive variable name box, and you want to choose your line listing. And the time period would be the month that you've just completed, so event date, year, month, so 06/2017. And then click run. That's all you have to do, just those few steps. That's pretty simple, and then you're going to get a nice line listing of all the events that you've put in for that particular month. Okay, and how was it categorized? We went through the different ways that you categorize, because remember, the system categorizes it for you. So that's never a question that you can alter or that you ever enter. So how is it categorized? We would want to do, again, the same way of line listing, only under the display variables, it would be important to add in, other than your time period, as particular display variable. And display variables tab, and you would look for one that said CDI assay, and you would select it over here, click on here, and move it over to this side. So you're adding in select CDI assay to your variable list. Click on run, and you get a nice column line listing, only now it has a new column that says CDI assay and tells you whether it's instant or recurrent and how the system categorized it. All right, let's look at CDI rate tables for just a minute. CDI rate tables are important for quality improvement. So let's look at those as the next report underneath a line listing. So we're going to click on rate table, and we're going to get those same tabs, only there's two left because you can't add in the display variables or sort variables up there. And again, it gives you that cumulative period that you want to group your information to. So the steps here for rate table are clicking on this, putting in a new time period if you want to do that rate for just 1 month or a quarter, whatever you're doing it on. entering your date variable, and then display options, you want to look at it all together in a cumulative manner. I can tell you for quality improvement, sometimes if I'm looking at a whole quarter's worth of data, I will put in the time period of being a quarter, but I will have it displayed by month to make sure that I put in all my data for January, February, March, or April, May, June. That's something that I check when I check other people's data, because what I'll see sometimes is January and March in there, but for some reason February isn't coming through. And the CDIS statistics, again, you see that for a rate table, we went through these before, and this is the order that is printed in the CDI manual. And so when you click on Run, you're going to get your rate table in this order. What I mean by, as you can see from this report, the first rate table they list is that total CDI rate, and the next table is the CDI treatment prevalence on admission. See, it's the same order as here. So what you need to do then is just scroll down on your rate table, and you're going to get all the statistics on that list. So rate tables are very simple to do. I do want to make one caution though. It's important that you look at the notes that are created after each table, because those are important sometimes. It tells you some exclusions that you may not expect that are in your report, and that's just to make sure that you understand what report that you're getting. So the notes after the report are important, and you can just copy. What I do a lot of times, I just highlight this area and put it on a PowerPoint slide, and I'm ready to go for my meeting. UTI rate tables, let's review those. Remember, you go to the HAI module, all UTI events, and then whatever rate table that we want, whether all UTI events or the type there. And you get a really nice report that looks like this. The only thing that's a little bit hard is it's difficult to know exactly what each of these column headings mean. So that's why I've put this box here. Number one, on that UTI count, what that means is the number of UTI events, and it's added your symptomatic, your abuties, and then your catheter-associated symptomatic UTIs all together. This one where I have the 2 above it, where it says UTI treatment, that's where the calculated rate ratio for new antibiotic starts for UTI, which is the numerator, over the total number of UTI events is calculated. So in this particular incident, the ratio of new antibiotic starts per total UTI events was 3.8. Number 3, the UTI rate means the whole total UTI incidence per 1,000 resident days. So the total number of UTIs per total resident days, and then, so that's the rate. Well, what's the difference with 1? 1 is just simply the total count. The rate is over here that you would follow on a monthly or quarterly basis. And then the last one is the catheter device utilization. So that's that last statistic we talked about. How many urinary catheter days did I use in comparison to my total resident days? Okay, and there's just a couple more that I wanted to review so that you would know what a couple of extra things that are very helpful, I thought. And these are a little bit more advanced, and so under analysis, you saw your MDRO, your HAI, and then there's an advanced link. You go down to pathogen level data and click on Antibiogram. Antibiogram is a very helpful report, and it's something we ask for a lot of times when we're reviewing facilities. to know, and this helps you know what resistance pattern that could be developing in your particular facility. So this is a real simple report to follow in NHSN. You simply go to show descriptive variable names, as we've said before, and antibiograms are usually most effective if they're done in a pretty large chunk of time. So I've put in here event year and done it for one whole year and clicked on run. That's all I've done, is gone to advanced, as I showed here, advanced pathogen level, antibiogram, time period, beginning and ending, and run. And I get a nice antibiogram showing what are the different pathogens that have been the cause of my UTIs, and whether they were sensitive or resistant to a whole host. I had to cut off the long stream of antibiotics that were listed there in order to show you on the slide, or else it was not tested. And you can start seeing where some resistance patterns that may be developing in your particular facility. It really should guide your antibiotic use. And then the last one I wanted to show you is an important report for antibiotic stewardship. And that's also under that advanced line listing, advanced, and you go to then facility level data and click on the line listing annual facility survey of nursing home core elements. And this is the one place where I can say just click on run, because this has only been available since 2015. You're going to do this in you only do an annual survey one time a year, so there really isn't ability to modify time. So you just click on run, and you're going to get a nice report that shows you how your facility is doing in their adherence to the 7 core elements of nursing home antibiotic stewardship. And in this particular facility, in 2015, they only met 3 core elements, and in 2016, they met all 7. That is a wonderful report to show that you're working on antibiotic stewardship and something to share with your staff, the improvements you've made, and to celebrate. Okay, how many of my UTIs had catheters? I like to look at frequency tables. That's another a bit more advanced report that you can do. Advanced event level data, because I'm just looking at how many infections I had, and a frequency table. This, I think, is a good one for quality improvement also. I would just choose frequency table, and then the time period I would want to do it on, and usually that would be a big chunk of time too, and then use a filter, because I only want to look at my urinary tract infection. And then for display options for frequency table, you have to show, remember, frequency table has rows and it has columns. So I want to know across the row for that year what the catheter status was of those residents who had a UTI. Then I get a nice little box that looks like this and tells me in 2017, out of the 24 UTIs that I've reported, only one of them had a catheter in place. So what does that tell me for quality improvement? I really need to focus on processes that are going to improve non-catheter related UTIs. So these are all reports you can report to your quality and infection control committee. And so just a few thoughts to finalize and summarize. Make a timeline to regularly analyze. Make sure you're doing monthly quality checks for completeness and alert monitoring. Generate data sets prior to any analysis after you've resolved all alerts. Read the footnotes in your report. Review your data for accuracy and completeness. If your report doesn't make sense, it may be just the way that you ran the report. Just try it. You can't break the system. You can't alter your data. We learn by doing, and you can really get some cool stuff. I think the antibiotic stewardship The Antibiogram, the core elements are great. It really solves that measurement portion you need of your infection control plan and really gives a direction for quality improvement if you go on to analysis, and really helps develop your surveillance priorities and give you some real reasons of why some things should be columns on your risk assessment and things that don't need to be. So that's my thoughts for today, and hopefully you've learned a few tips and tricks in order to get that data out that you've been working hard to put in. And now I would be very interested in the questions that you have.
Thank you so much, Peg, for providing this excellent presentation on NHSN reporting. While people are thinking of some questions or chatting in some questions, you can also open your phone line with *5 if you'd rather ask over the phone. Lori, can you tell me, are there any questions currently in chat?
I don't see any questions at this time.
And Nikki, do you see anybody opening their phone line?
Nope, there are no questions on the line yet either.
Okay. Well, while we wait for that, if there are any questions, just continue. We have about 4 minutes, but I do want to thank you guys for your participation today, and we hope you found the information valuable and applicable. Thanks again to Peg Gilbert for making it a successful event, and we appreciate her time and participation. We invite you again to visit the Great Plains website at greatplains.org for resources and videos to help you sign up for the CDC NHSN database, as well as other initiatives being led by the Great Plains Quinn. Be sure to join if you're not currently a LAN or Learning in Action Network member to receive notifications for future educational offerings provided by the GP Quinn. We ask all attendees to complete the evaluation form for today's event to offer us feedback and help us plan and coordinate future events. Your input is very important to us, and we want to ensure we're meeting your needs in all of our educational offerings. So, Laura, I'm going to ask you. Oh, yes.
We do have a question from Evelyn Colbard, and she writes, I currently only report CDI. Can I start recording UTI?
This is Peg, and you can start reporting new measures at any point in time. I always encourage people to, if they're planning on doing that they start at a defined period. So we're just getting ready to start a new year. So January would be a great time to look and assess what are our needs on your risk assessment and determine what are the measures you need to have so far as quality improvement. So starting with January data would be a great time to start a new measure. It certainly doesn't cost more, or there's no charge for anything you enter into NHSN. And the more people in long-term care that put their data in, the better this data and our benchmarks are going to be going into the future.
And Peg, I might add that there, on the CDC or the NHSN website, there would be a tutorial on the UTI aspect of reporting, correct?
Yes, there is. Yes, there is. There's great training on the website on how to enter the data, and we reviewed some of it today, but there are some very specifics to make sure you're counting what they consider. You don't in your line days, you don't include suprapubics and things like that. But it would be important to do that tutorial and then ask any questions you'd have after that. I'm sure that the state contacts or myself would be glad to answer them for you.
All right. Well, we are at the top of the hour, so this will conclude our presentation today for everyone. Thank you all, and have a great afternoon.
Thank you all, and thank you for the work you do on a daily basis.